Hey guys, so welcome to Q&A Friday. We've got 3 great questions, so I'll just get right to it. So the first question comes from Eleanor Smith, and she asks, Dr. Connie, I'm having trouble knowing what to eat for protein if I have lupus, gout, and high cholesterol. All right, Eleanor, so you've got some inflammation in your body. So it's in your best interest to eat protein contents that are high in omega-3s, which is anti-inflammatory. That would include Alaskan wild-caught salmon, and organic chicken and quinoa are great options for you with lupus, as well as taking some supplements that include omega-3, fish oil, curcumin, and probiotics are also great ways to help you keep the inflammation down in your body. So those are some protein choices, and just keep in mind too that taking everything in moderation is going to be key, and some of the vegetables too, and including some fiber in your diet will also help you to lower cholesterol as well. So I hope that helps. All right, second question is asked by Autumn Jackson, and she asks me about Benlysta. So hi Autumn. Benlysta is the newest drug specific to lupus, which was approved by the FDA on March 9th, 2011. Benlysta have been shown to reduce autoantibody levels and help control autoimmune disease activity in patients with lupus. And Benlysta is considered the first breakthrough treatment drug for lupus because it's the first drug approved to treat lupus specifically in more than 50 years. And it's especially good because rather than other treatments for lupus where we suppress the entire immune system, Benlysta targets only specific immune cells that are active in lupus. Other common medications were never FDA approved specific for lupus, but they were used off-label to treat lupus. The side effects of Benlysta are minimal compared to other toxic treatments, but the side effects include nausea, diarrhea, fever, sore throat, runny or stuffy nose or cough, pain, itching or redness or swelling where the injection was given, and pain in your arms or legs, headaches, depressed mood, or sleep problems. I've been on Benlysta after my 3rd relapse as a preventative measure, but I had to be in full remission with nephrotic syndrome prior to starting Benlysta. Anytime a medication suppression or anytime a medication suppresses the immune system, it can lead to increased chances of developing certain kinds of cancers as well as serious brain infection for Benlysta. So all the ways to get holistic intervention to effectively wean off toxic meds, that includes Benlysta, is what you should strive for. And typically, the doctors want you to return to get infusion on a monthly basis. I've toyed with the length of time between my infusion, despite what my doctor said, to minimize my injections when I was getting them. I think it's a rather safe drug compared to most other drugs. So, and when we're in acute flares, I believe we do need medical intervention. So taking those things responsibly will be key. But again, as lupus rebels, focus on doing your part to reverse your disease and create health while your doctors manage your disease is an important concept that I never want you guys to dismiss. The last question comes from, is it Lida or Lida? Or it's Lida probably. She asks, I was wondering, what are your thoughts about Dr. Brooke Goldner raw plant-based diet? Her book, Goodbye Lupus, said to incorporate lots of omega-3 to smoothies. However, I read that flax seeds contain lignans, afraid of poisoning in high amount, and hormone-sensitive cancers. Is it safe to eat large amounts of flax seeds without negative side effects? So, my take on any type of diet, whether it's Dr. Goldman? I'm sorry, Dr. Brooke Goldner. Whether it's her diet or any other autoimmune lupus paleo diets, I believe Everything is should be in balance, okay? It should never be restrictive. And I personally don't believe in diets. I believe in eating whole, minimally processed foods that are organic. Having said that, I also believe that there are different foods for different phases of lupus as well as for different individuals. I personally don't do well with raw plant-based diets. I do better eating meats in moderation. Too much fiber upsets my already sensitive and leaky stomach, and I have to be very careful to minimize my intake of too much fruits. I can get bloated and sick fast. As for the flaxseed, I do think that you should never go excessively to a point of, where you're questioning if this is going to be harmful for you. So I would recommend that you take it in moderation, anything. This goes for any kind of food. So always think in terms of balance. Some may do well for if you stay on a vegan diet like that. But generally for specific illnesses like for lupus, I feel like it's over ambitious. And keep in mind, I was a vegan for a very long time, just prior to getting diagnosed with lupus. So I don't know if it's healthy and the solution for everybody. Our focus should be on healing our gut by taking away inflammatory foods, as some foods, even if they are plant-based, can be reactive and cause inflammation in some of us. So again, it depends. There is no one-size-fits-all diet for everyone. Sure, there should be different diets for different phases, and everything should be in moderation and in balance. And again, I find that extremes such as keto, paleo, vegan, plant-based diets all have certain limitations. We should respect natural order, eat whole foods in season, in moderation, organic, sustainable, agriculture, etc. We should also incorporate movement as well as stress management to try to stay balanced in our body. I do hope that helped you somewhat answer that question. I know it was a long answer to maybe a specific question, but it's never one thing. It's never one type of food. That's important point to across is why I said what I said. So comment below if you have further questions. Otherwise, I will see you guys next week.